Hi, this is Navya. So here there is a pharmacology syllabus. So under the syllabus, I have already discussed from chapter 1 till chapter 9 and have uploaded in the playlist. And if you're not watched, I'll just provide you the link in the description box so that you can watch all these chapters. And now in this video, I will be taking a class on the chapter 10, that is antiseptics and disinfectants. So let's start the class. Chapter 10, that is Antiseptics and Disinfectants. So under this chapter, we'll be learning what are antiseptics and what are the uses of the antiseptics. In the same as disinfectants, so what are the disinfectants and what are the uses of disinfectants, and also we used to compare the difference between the antiseptics and disinfectants. So let's learn first about the antiseptics. Yeah. So what are antiseptics? So basically, when we gonna apply this antiseptics is whenever we found the wound or cuts, then we just apply the antiseptic. So why we will apply only this for the wounds or for the cuts in our body? That is very simple. This antiseptics, it act as a chemical to the skin. So this is the chemicals. So what the people will do? That people what they'll do is they gonna apply on the skin. So they apply on the skin. Then what it will result if the people apply on the skin of the body? So what will be the results? So that results in reducing the number of microorganisms. So it will reduce the number of microorganisms. That microorganism that may be present, that may be living on the skin, in the wounds, or in the mucous membrane. Yeah. And also we have different type of antiseptic. It is not like that we use the same antiseptics for all types of the problem or the damage. It's not like that. There are different types of antiseptics, but each antiseptics is differ from each other. So that may be differ in the cost maybe, or the effectiveness, or the side effects. These are the difference in the types of the antiseptics. That may be the side effects also. Some antiseptics, by just applying of some antiseptics, that may cause damage to the skin or some reddish or just inflammation. So these kind of things, it may be result from the antiseptic. So that will be depend on the type of the antiseptics, the effectiveness, and also the side effects, and also the cost. So now let's know the usage of this antiseptic. So the uses of antiseptics. So the mainly it is used for the skin, in the wounds, maybe cut or damage in the skin related issues, we can just tell it. And so why, and also it also may be used to prevent the infection, to prevent the infection on the skin. And one of the using it also used as the for the cleaning the skin. So that is before going to any surgery. for the hygiene purpose, it may be used. Uh, Clean the skin before going to the surgery, and also treating the throat related issues, throat infection by just mouthwash. This may also reduce the infection, the mouthwash. And also one more usage, that is the cleaning mucous membrane. Mucous membrane. Yeah, so these are the uses of the antiseptic. So now let us know disinfectants. Yeah, now let us know what are disinfectants and what are the uses of this, and also the difference between in the last session. So as we are comparing with antiseptics and disinfectants, it seems some will be similar, and we have some different similarities also. Similar in the sense, this antiseptics and disinfects, so both are chemicals. So these are the similarity. And now let us know the usage or what are this in disinfectors, and then coming back to the difference. So this disinfectors, as I said, these are the chemical agent. So that is mainly designed to inactive, whereas in antiseptic we just noted it will reduce the microorganisms, but here disinfectors, it is designed for to make the inactive, or it will inactivate the microorganism. Inactivate in the sense it may destroy also. It may inactivate or destroy the microorganisms on the inert surfaces. On the inert surface. These disinfectants are quite different, somewhat strong content. It will designed to inactive or deactive or destroy the microorganisms on the inner surfaces. And this disinfectors, this does not necessary to kill all the microorganisms, and also especially the resistant bacterial spores. It is less effective than the sterilization. So which is an extreme of physical and chemical process, that kills all type of the life, and this disinfects. This also acts as a this disinfect also act as a antibacterial. We can also call it as an antibacterial. Why? Because it will destroy the microorganism which is present on the skin. And antibiotics, we can also call this as a antibiotics. Yeah, and it is not exactly same, but some quite different will be there in this. Yeah, so this is the disinfectors. The common difference is both are chemicals, but quite different is that it is designed only for to destroy or to deactivate the microorganisms on the inner surfaces, and very less effective than the sterilization. And this is like both physical and the chemical changes. This is a chemical agent as when we are comparing the both. So now let us compare the disinfectants as well as the antiseptics. Yes. So here disinfectants versus antiseptics we are just discussing. So what people use antiseptic, so such as like there's an example, that is peroxide. So this peroxide, usually this is used to kill the microorganisms. This is used to kill the microorganisms. So that is present on the skin or the mucous membrane. Yeah. So this is the peroxide. This is used to kill the microorganisms that is present on the skin and the mucous membrane. And also the antiseptics. This antiseptics, this will destroy some germs, certain germs that is present on the skin. And whereas disinfectors, what it may do is, this will remove them from the object. So this is the main difference between the antiseptic and the disinfects. This antiseptic, this will destroy the germs where that is present on the skin, whereas this disinfectants, this will remove them from the object. And other differences, both are the chemicals. This is the common difference, common similarity, not the difference. And in fact, what does it happen is, it shares some similar active ingredients, not inactive. So it shares the active ingredients. So, however, this disinfectants, this tend to have the higher concentration. This tend to have the higher concentration. So that is why it is not directly applied to the skin. This disinfects directly. It is not applied to the skin. Why? Because it has the it tends to have some higher concentration. It is not suitable to use to the skin or the mucous membrane. Yeah. This is what the difference between antiseptics and the disinfectors. This is not directly used for the skin or the mucous membrane. So now let us know the other difference between the antibacterial. Yeah. So let us know this antibacterials. As I also said, disinfects is also referred to as antibacterials. Now let us know what is this antibacterial. So by the name itself, antibacterial, those are the chemicals. So why people use this? People use this to clean the areas of the skin. I can give you the example for this antibacterial. I can just give the example as the soap and the spray. So this contains the antibacterial. So antibacterial, what does it do? It is a chemical. So the people use these antibacterials to clean the area of the skin. And an example I can just tell as I can give as a soap and the spray. So these soaps and the spray, these are the antibacterials. And now let us know the commonly used drugs. So we'll list some of the drugs which are used commonly as antiseptics or disinfectants. Yeah, as I said, there are different types of antiseptics. It may not be same for all types of wounds or types of infection. It will be different for each infection. And these drugs, this antiseptics, as I told, for all the wounds and all the problems, it cannot be used, but there are some types. So we can go for these types. In these types, some antiseptics can be used at the home, whereas other we can take just a few. So few antiseptics they're not supposed to use at the home because they need some hospital setup. It required some equipment, it required some hospitality uh, condition. So it it contains the it needs the hospital setup, so it cannot be used at the home. Only few can be used at the home. So now let us know some drugs names or some usage list at the home or at the hospital sector also. Yes. So list of the drugs. What I can write? List of the drugs. Yeah. So some of the drugs or commonly it has been used is the alcohol. So this alcohol is the antiseptic. It has been used for uh, some type of problems. So this such as alcoholic in the sense such as isopropyl alcohol. This is a type of the alcohol, and the ethyl alcohol. Ethyl alcohol. So maybe isopropyl or the ethyl alcohol. This can also be used as an antiseptic. And then next we have quaternary ammonium. These are the antiseptic. That one we have to remember. Compound. Then we also have that is chlorhexidine. So this is used before the surgery. Before the surgery, this antiseptic has been used. Surgery or the operation, we can tell it. Yeah. And the most common thing is antibacterial dye has been used everywhere. Antibacterial dye. This is used to treat the burn. This is used to treat the burns and the wounds. And we also have halogenated phenol that will be present in the soaps and the solution. Yeah. So these are the common list of the drug will be present in the daily life. So alcohol is very commonly this may be isopropyl alcohol or the ethyl alcohol. Yeah. And quaternary ammonium compound. This is a type of the list of the drug. Then antibacterial is a very common that is used to treat the burns and the wounds, cuts on the skin, damaged skin. And halogenated phenol, this will be present in the soap as well as in the solution. So these are the list of the drugs we have been discussed. And now let us know the type of disinfect. So these are the list of the drugs as well. This is the type of the antiseptic. Antiseptic. So now let us know the types of disinfectants. Yeah. So let's know the types of disinfectants. Yes. So here we will be discussing on two topics, that is A disinfectants as well as aldehydes. So these two topics we'll be discussing here. So A disinfects, as the name indicates, the A. So firstly, this is the chemical substance. This is the chemical substance. Yeah. So that is capable. So that is capable of disinfecting the microorganisms. Disinfecting the microorganisms. And the topic is A. So this is a chemical substance that is capable of disinfecting the microorganism that is suspended by the air. Suspended in the air. So this is about the air disinfectors. And these disinfectors are generally assumed to be very limited to use on the surfaces. But that is not the case. Whereas here, aldehydes. So here, this aldehydes such as formaldehyde, so this have the wide range of the microbial. So this has a wide range of the microbial activity as well as the fungicidal. Yeah. So here in this, there are very partly inactivated ingredients. Inactive, we can just tell inactive ingredients or the organic matter that have very less of the residual activity. So now let us know some other name of this disinfectors. Yeah. So the other name is here we have the hydrogen peroxide. Yeah. So this hydrogen peroxide vapor. So this is used as a medical sterilant. This is used as a medical sterilant and as the room disinfectants. Yeah. And coming to the ozone. So this ozone, we all know this is a gas that is used for the disinfecting water. This is used for the disinfecting water or the laundry, food, air, and surfaces. This hydrogen peroxide and here we have ozone. So hydrogen peroxide means this is a vapor that is used as a medical sterilant in the room disinfect. Whereas this ozone, this is a gas that is used for the disinfecting water, laundry and food, air and surfaces. And this is the chemically aggressive. And what does it do means it will destroy many organic compounds. What it will do, it will just destroy the many organic compounds. This is the main thing. So this destroy of the many organic compounds and that may be result in the rapid decolorization and deodorization in addition to disinfection. And one more we have, that is potassium permanganate. Yeah. So this is usually this is in the purplish black crystalline powder. In the crystalline powder. So this colors everything it touches through the strong oxidizing. So how does it touches is the strong oxidizing action. Strong oxidizing action. It touches on this, and this includes what and all it includes is the stainless steel. So this includes the stainless steel, and also it is very necessary to use the plastic or the gas containers. Yeah, that is all about this potassium permanganate. So here we just discussed on the antibiotics as well as the disinfectants. So we discussed the both are chemicals and we discussed about the uses of this and also the difference between of this and the types of antibiotics as well as the disinfectants also we have discussed, and also we have discussed about the antibacterial. Antibacterial is nothing, the example is we saw that is a soap or the solution. Yeah. And we discuss about the two things, that is the types of disinfectants, that is the air as well as aldehydes, and the ozone and potassium permanganate and hydrogen peroxide. So that completes the chapter 10.